katau Oe ha he te uma He koe viso ne ni kotu umo uma Oi au he kelesi mo e ta whenga monu Ko tau lo fuku vehi mohoto wheleni Pangai o e hau unua ki e whanua Tupu au he lo au whai ke tupu tupu a Ko hai e rea tupu i pangai Ko malo e fia fita i tō e la a Hopa kani watangi mo e te iko Kalanga e tokanga ke kaua ki loto Ka whelu te nie o whawhio mo e merino A whita ula loa e pule alangi ki he
Welcome to the broadcast of the Voice of South Pacific, a Pacific Islanders broadcast from Seattle, Washington. Today is Tuesday, June 17, 2025. Welcome everybody, and we're so glad, such a great opportunity to join together with Elizabeth Beaber. She's a manager in the vaccine program for public health, Seattle and King County. And she will be talking about the COVID and measles vaccination. And also thank you, Kate Cole. And also we have Dr. Pakieli Kafusi, is also like our Islanders doctor. And I have Lai. But before we continue on, I'd like to, everybody, our special guest, to please introduce yourself as we continue on. Welcome, Emeline Pahulu. She's also like community leader too. I'd like to give this opportunity to Elizabeth Beaber. I know there's some people that are trying to join in, but we can go ahead because I know that we're in American time, not the islands time.
Well, good afternoon. I'm happy to be here. My name's Elizabeth Beaber, and I'm with Public Health Seattle, King County. I lead the adult immunizations team there at King County.
Kate?
Yeah, hi,
So,
Kate Cole. I'm on the communications team at Public Health, and so appreciate you dedicating so much time to this, Sylvia.
Thank you, Kate. Okay, and we have Dr. Pakieli. If you just want to introduce yourself to our Seattle and King County Public Health Department.
Yeah, good morning, everyone. Hawaii is still morning, though. My name is Pakieli Kafusi. I work for the University of Hawaii School of Medicine, and I'm working in the Tropical Medicine Department.
Thank you so much.
And I help a lot with the Tongan community.
Yes, indeed.
Yeah, thank you.
He's our weekly healthy lifestyle advice on our program. Yes. And Lai, can you introduce yourself?
Yes,
Lai
I'm Lai
and
King.
your native islands.
I'm Lai King. I'm from the Samoan Islands. I'm actually in Fife right now. I'm with the Pacific Islander Health Board of Washington, and I'm the Environmental Justice Manager.
Thank you, Lai, for joining in. Thank you for representing the Pacific Islanders Health Board. Okay, Emeline Pahulu. Hi, Emeline.
Hi, good afternoon, everyone. Sorry I'm not on camera, but I work for Washington State Employment Security Department, and we also do a lot of resource fairs around the county in Pierce and King County. Thank you.
Thank you so much, Emeline. So as we're going to start, we have some question, and also feel free if you have any question that is related to the topic. Again, everybody, please share. We are going live on social media, Facebook Live on Voice of South Pacific, and also on YouTube. If you're home, You can watch it on your TV screen. Right? It's Voice of South Pacific by Seattle King County Public Health. And the topic is about vaccines, COVID and measles vaccination. So I'm gonna give this opportunity, to go ahead and start live. What would be your question or anything that you wanted to share? Thank you.
Hearing about the new variant, my question would be like, what should we know about that new variant?
Yeah, that the new variant, the new COVID-19 variant has definitely been in the news. And the newest variant, its name is NB181. And it's behind what we've seen in some countries in Asia, which has been a rise in COVID-19 cases. And so we know that the COVID virus mutates. It's going to continue to mutate, and that's really expected of this virus. And bottom line, though, there's no major concern so far about this new variant, but it does remind us about the importance of staying up to date on COVID vaccination, and that, each year the COVID vaccine is really tailored to protect us against the most recent variants. And it's these vaccines they're really going to remain our best defense to protect against severe illness from COVID-19.
Did it answer your question? Okay, we're gonna switch to Emeline, and then after this, we're gonna go to Dr. Pakiali. Emeline?
So, Elizabeth, question. So, is it okay to promote the COVID vaccine? So, is there a newer one compared to the one that was provided late last year?
Yeah, great question. So so for COVID vaccine, the last update to the vaccine was in September. So September
Right.
2024. Yeah. But we do know there's still folks, who maybe haven't had a chance yet to get that vaccine, and that vaccine is recommended for everyone who's 6 months and older. They should, if you haven't had a COVID vaccine since September, you should get one. And then also, if you are 65 or older, or if you're immunocompromised, either moderately or severely immunocompromised, it's recommended that you have 2 doses of that shot. So 2 doses that are about 6 months apart to better protect folks in those groups from severe COVID illness.
So, do you have anything in writing, Elizabeth, regarding that, especially for the older community members? Because I think a lot of people took the one in September, but they did not know that they need to follow up, especially the one that needs that second dose.
Sorry,
One,
hold on.
one idea, Emmeline, is we can email some information to Sylvia right after
Yes.
this call so that she can help put it up on the Facebook page. And then we at King County have a web page to help people find vaccines near them. And that web page has a nice, I think, easy to remember address. It's kingcounty.gov/find a clinic. And again, I will write that into an email to Sylvia along with some basic information about who needs the COVID vaccine, depending on their age, immunocompromised. And Sylvia can share that out with all of you and put it up on
Yes.
the Facebook page.
I sure will.
Thank you. Appreciate that,
absolutely.
Kate.
Yeah.
Thank you.
And I got some detailed information from the King County Public Health. I can share the informational connection. Well, thank you so much. It's such a joy that we had our registered nurse as married to Ifua, as he works so hard, to achieve a long-term goal. And welcome, Mary. Thank you so much for joining us. Do you have any question about the topic today? Is about the COVID and measles vaccination.
Okay, so I'm an adult family home consultant. I teach for the DSHS required adult family home administrator. So I consult with many homes throughout Washington State. I do have a pretty big platform on Facebook when it comes to adult family home compliance, so a compliance nurse. I try to help people keep those residents safe. So my main question is how is your community outreach with getting those vaccinations or booster shots into the adult family homes? Are you working with the pharmacies? And I know a lot of them probably are behind on their COVID booster shots. And how are you educating the public regarding its safety?
Yeah, thanks, Mary, for asking that question. I can start first with adult family homes. We have many adult family homes in King County, and actually now for it's been over 3 years that King County Public Health has offered mobile vaccinations to adult family homes, and we have then had our partners who are mobile pharmacies in King County, who then have actually gone out to adult family homes who need some additional support to get vaccines to make sure all those residents are vaccinated. And this spring, we've been really busy because many folks in adult family homes, if they're 65 and older, they're now due for that second dose. So that's been 6 months since the one in September. So we have 2 mobile teams right now, actually, that go out and it's no cost at all to the adult family home or the individual. And we make sure the residents at the home can get COVID vaccine. And then also we are doing flu and RSV. And then additionally, staff members too, we were offering vaccines at no cost. But I will say, though, that all of this work was thanks to federal funding for COVID-19. And unfortunately, that federal funding is ending. So the program is now needing to end, this mobile program that served adult family homes. So our last visit will actually be on June 27th as we're winding down the program. So it will be then adult family homes will need to find long-term care pharmacies and other ways to try to get vaccines to their residents. Go ahead.
I have a question. Do the residents need an order from the doctor before getting the vaccinations or any other vaccinations? Of course, right? So that will also take extra time to get that vaccine in them. Can you hear me okay?
Yeah, you went out a little bit, but so for COVID vaccine, if you are 65 or older, or you are immunocompromised, you are recommended to get the 2 doses. So you don't need an additional note or anything from the doctor. And tell me again the second part of your question.
I didn't remember it. So, but what about accessing it? And actually, the second part was like just the timeline. Since now we're winding down, we have 10 days. So how are we going to be able to expedite that? And what is your advice on that for the adult family homes?
Yeah, so right now we at King County we did lots of outreach to adult family home owners, and we did that in May and let them know this program was ending, and so we are scheduling lots of folks. We do have a number that folks can call or an email, but we are starting to move down with less availability because we only have 2 weeks to go. My recommendation then for resources would be for adult family home owners to connect with a long-term care pharmacy and to see what kind of options they may have for the future.
Thank you so much. I'll reach out to the pharmacies and just kind of see how they're doing. Thanks for
Yeah.
all the work that you do at the King County.
Oh, thanks for the question.
Okay, thank you, Mary. And I will ask my question, and then the best comes at last, which is the doctor. Okay, so the one of the vaccines, what about the people that have cancer? Are they good, to do all those required vaccinations, or they have to seek, the doctor's advice?
Yeah, so I'll say I'm not a medical doctor, and
Okay.
when it comes to decisions that are going to be between a patient and their provider, that's really a space where the healthcare provider is going to know the patient best and give the best recommendation. I'll say though, what I do know is that the COVID-19 recommendations for those who are immunocompromised, and some people who are receiving treatment for cancer may be immunocompromised. Again, they should talk to their doctor. But the recommendations are that those who are severely or moderately immunocompromised should have 2 doses of the most recent COVID-19 vaccine spaced about 6 months apart. So if they had one in the fall, then they would be due again for one in about 6 months, but there's flexibility in that timing for them.
Okay, thank you so much, Elizabeth, for answering that. Uh, and then also, I hear a lot of people talking about measles. Is the measles right now is spreading more than usual?
Yeah, so you're right. Unfortunately, we are on track right now to have the worst measles year in the US in 30 years. So as of last week in the US, we have close to 1,200 cases of measles in the US. And, measles, it was once eliminated in the US, and that was due to really high vaccination rates for the measles vaccine, which is MMR. But, recently the vaccination rates have dropped, and what we've seen is increase in outbreaks around the world. And this has led to more cases in the US and including right here in King County. So in Washington State this year, and we're only in June, we've already had 6 cases of measles in our state.
Right.
Yeah, and also share, you may be familiar with there was the awful measles outbreak in Samoa in
Yes.
2019. Yeah.
Yes.
And it was heartbreaking, and almost 100 people, mostly children, died. And it's like during this tragedy and the trauma, what we saw was the Samoan community really rallying together to
Wow.
get vaccinated and to protect their community. And so just emphasizing the power of the collective response of community that can help end outbreaks and help vaccinate people and protect not just yourself, but your entire community. And we've seen the Samoan community do that in the past, and communities doing that right now too in parts of the US as well.
Thank you so much for answering that. You answered my question. Thank you so much. And then now I'm gonna give all the time, to Dr. Pakieli Havilikafusi.
Thank you, Sylvia, and thank you, Elizabeth, especially for all of you that are here today. I take this time to just to follow up some of the questions, like Lai's questions, the variants, and also Sylvia's questions. I just want you, Elizabeth, to explain to the people, if you can, in the simple language, that even though we have these variants, but the the vaccines that we are having at the moment, people can be protected. So I just would like you, Elizabeth, to explain those information to the general public. Thank you.
Yeah, happy to do that. So, as I mentioned before, the COVID virus, it changes. It kind of mutates and adapts to what's going on in its environment. And the COVID vaccine we have right now helps protect against the current variant of COVID that we have. I'll say, the COVID shot is not a one and done shot. It's, we do need to have seasonal boosters to help our bodies remember that virus and help us stay healthy. So, like, one way I like to think of it is if you need to do updates for your computer, or if you need to do updates for your phone. Um, it's kind of by getting these seasonal boosters, these vaccines for COVID, you're sending these kind of updates to your body, to your immune system, to say, okay, it's changed a little bit. I'm now familiar with it, and if I am infected, I still may get infected, but I'm much less likely to get sick, and I'm much less likely to be in the hospital for it. Does that
Thank you,
help?
Elizabeth. Yeah, just to add on to Elizabeth's
Please
answer,
join in.
for my people and also the Pacific Island people, what Elizabeth is trying to say is that when you are vaccinated once, it can protect you just for a certain time. That's why you needed to revaccinate again, because that's like training your immune system to be able to fight the infection. So that's important to update your vaccination. The other thing also, Elizabeth, talking about the questionnaires, yeah. So because Sylvia is asking the very critical question, and it's very sensitive questions, especially for those with chronic diseases and even cancer. So it's important, the questionnaires that they have to answer before, because every time you go to get vaccinated, you actually require to fill in the questionnaire, and you have to be serious with answering the questions, because the determination by the doctors or by the nurses to vaccinate you depends on how you answer the questions. So, Elizabeth, can you talk about that importance of the questionnaires and be uh, do you have to answer it correctly?
Yeah, when you get a vaccine, you're right. You have this questionnaire where you need to share some about your medical history. And then what's important there is, whenever you're vaccinated, you have a trained public health professional, oftentimes a nurse. And it's that nurse who has the knowledge, who can talk to you about anything that you complete that may need further discussion. And so, absolutely, fill out those questions accurately, and then you're able to better inform the public health provider who's working with you about what vaccines are best for you and the timing that's best for you.
Thank you, Elizabeth. Just to add on to that one, it's important that you answer the question correctly, and if you have any medical problems, you have to let the nurses know, because some of you may experience side effects when you are taking vaccination. So that's why it's important, yeah, because they will determine from there whether you're going to receive the vaccination or your body is ready to take the vaccines. So that's why it's important to follow the questions, answer the questions correctly, and then they will make the determination there. Because the thing is, Elizabeth, some of our people, even the Pacific Island peoples and also my Tongan people, when they're having the side effects from the vaccination, they think that the vaccination is bad. It's really not helping them. So that's why I'm actually like, I would like you, that's why I asked that questions for you, to clarify that to the community. So just to follow up, I'm sorry, Sylvia is putting me on the spot here, but I just follow up with another questions. So as you say that we are getting towards the end of the funding from the federal government regarding the vaccines, Can you please clarify to the people the reason why they stop? Because there are a lot of things is actually going around social medias saying that now they know that the vaccine is bad and all those kind of
Yeah.
things. Can you please clarify
Oh
and
no.
tell the publics that the vaccine is good? There's nothing to do with the ending of this funding for the production of the vaccine.
Yeah, so for the COVID vaccine, we
Eh?
have a lot of studies that have shown how effective the COVID vaccine is in protecting people and keeping them out of the hospital and lowering their risk for severe illness from COVID-19. So the data is there and shows that. In terms of hearing about, people may have heard about changes in federal recommendations around the COVID vaccine recently. And I'll just say that these changes that we heard about COVID shot recommendations at the federal level, that they weren't made, using the following the usual process. And so, in terms of any changes to recommendations, there many public health experts and doctors do have questions about, what these recommendations, like how they might affect people, and we do expect there might be some more changes to come in the weeks and months. But back to what you were saying, is that we know the importance of getting the COVID vaccine and how it can help keep people healthy. And we also know that the COVID vaccine is safe to get. And that, as I said earlier, it's not one and done. So we know the virus mutates, and we have a vaccine right now that will help protect against the variant that is circulating.
Yeah, thank you, Elizabeth. Just to add on to Elizabeth's answer for these critical questions, it is I should say that it is a political reasons why things are actually like this at the moment. But the other important things that Elizabeth is emphasizing, this the reason why she's confidently saying that the vaccine is good because it's science based. It's not just based on your thinking or your opinion. Yeah, it's based on studies. It's based on scientific evidence. So that's why I think my community, we are not trying to politicize anything, but just to remember we are trying to protect your children and we are trying to protect our people. And so there are a lot of things is floating around on social media. Please do not believe those information. You have a freedom to choose not to take it. But at the same time, also know these are the scientific community. We all support the vaccination and the importance of follow up with your vaccines, especially at this critical time where they end the funding for the vaccines. It's important that you take advantage of this last shot if you haven't done it. Like Elizabeth said, that in order for this vaccine to work really strongly in your body, protecting you from the virus, you have to keep vaccinated with this. So I should let the others ask questions, and I take a break, and I'll come back to the floor. Thank you.
Thank
Thank
you
you.
so much, Dr. Pakeli. As we continue on, we have some new people joining us, but I see that your hands are up, Lai. You have another question?
Yeah, I actually posted it in the comment section, but I'll just say it right now. Are the current COVID tests, are they effective against the new variant?
You're asking for testing to see if you have COVID. Would that test be effective with the COVID we're seeing right now in the
Mhm.
community? Yes, it would.
Okay.
So testing is always an option if you are uncertain if you have COVID or allergies or something else.
Thank you.
Okay, Lai, did it answer your question? Okay, Lai is from the islands of Samoa. Okay, I have three more here. Mary Nichol, please introduce yourself. And I'd like to ask everybody that are in the chat and also joining us, please share that, to all your friends, and also on Facebook and also YouTube Live. Especially, like some of them, would like to understand, native language, and you are the representative, of your native cultures. Mary Nichol, please introduce yourself and ask any question about measles and vaccines and COVID.
Yeah, Bula Vinaka, everybody. I'm from the Fiji Island here in Marysville, taking care of the Fijian community here in Snohomish County. My question was, is measles and COVID related? Are they related?
Okay. Yeah, that's an interesting question. So, I mean, they are both viruses, and they are both viruses that we have vaccines that we can take to then protect ourselves against them.
Yeah,
Okay.
just to add on to that, Mary Purvinaka,
Bula Vinaka.
asking good questions. Yeah, like Elizabeth said, they are both viruses, but they are different viruses. So the vaccine that you are getting for COVID cannot protect you against measles. So it's a completely different vaccines for the two viruses, but they are both viruses. Yeah.
Yeah.
Yeah, measles is different from the COVID, but they are both viruses. And also the vaccine that you are taking for COVID cannot protect you against
For
measles. So you
measles.
have to take the measles vaccines in order to be protected from measles. But also, Elizabeth, can you help talk about the how infectious is the measles compared to the COVID, or the differences between the transmission of the two viruses, so that the community could understand. That's why it's important that they vaccinated, because of the contagious of these two viruses.
Yeah, and I can, the reason why, one of the reasons we're talking about both COVID and measles right now is because we are in the summertime and we're moving into summer. And we know, in the past summers in King County and in the US, we've seen this spike in COVID cases. So we know that's what's happened before, and we might see that again this summer. So an important time to get vaccinated and be up to date for COVID. And then the reason now we're also talking about measles this summer is because of what I shared earlier, where we've been seeing measles outbreaks across the US. Measles has been coming in from folks traveling internationally and then bringing it home. So that's the link of like why we're talking about both of these right now, is we really want to encourage community members to get up to date on these viruses that are around this summer. The question you asked then was about how infectious each of these viruses is. I can start with measles. So measles is actually one of the most infectious viruses that we know. It can actually remain in the air in a room after someone who was infected with measles leaves the room. And so it's extremely contagious, and it spreads through the air when a person breathes out or coughs or sneezes, and again can lead to much more serious disease than many folks realize. Measles can lead to pneumonia, brain swelling, death, and about 1 in 4 people who get measles in the US end up having to be in the hospital. So all of that to say is it's a very serious disease. It's very contagious. But the really good news is that we have an incredibly effective vaccine that protects against measles. Then for COVID, you asked about how infectious is COVID. COVID is mutating much more. It mutates and changes more frequently than the measles virus, and so it does kind of evolve how infectious it is. But again, another virus where we have a safe and effective vaccine that can help people stay healthy this summer.
Thank you, Elizabeth. Thank you for answering that questions. But I think I should ask another question just for clarification because I really facing a lot of problems with talking to my community with all the political things that's going on and all the anti-vaccine stuff and linking the vaccines for measles now to autism. Can you please clarify to the public that the MMR vaccines is not leading, there's no scientific evidence to prove that is leading to autism? Because it's really gumming up like they keep asking questions after questions of that, and then they are feeling they are very close to be anti-vaccine too. So that's why I'm kind of concerned as you talk about contagious of these viruses, and as you also mentioned from your area answer about the 2019 outbreaks that happened in Samoa. And I believe there was more than 2,000 infection and about almost, like you say, almost 100 died, but mostly children. So can you please clarify on that one, the link between the autisms and also why is it really affecting children worse than adult in terms of the infection with the measles?
Yeah, well, I mean, you said it, and I'll repeat it, is that there have been many, many studies done looking at if there is any association between taking the MMR vaccine and autism, and no studies have shown that there is any link. And so, as you said, we want to make sure that accurate information is in the community, that there is no link between the MMR vaccine and autism. What I'll do is put in the chat here, Public Health King County, we have a whole website about the measles vaccine because we know we're hearing lots of questions, like you mentioned, from community. And on that website, it has the history of the MMR vaccine, all of the safety studies that have been done, all of the monitoring studies, and how they all conclude that the measles vaccine is safe, and it's much safer to get the measles vaccine than to get measles. So definitely encourage you to go to that website. We also have there are some really great graphics that you can share with community members, flyers, and Q&As to address exactly those questions you mentioned for people who really want to learn more about the MMR vaccine and why it's safe and how it protects you.
Oh, thank you, Elizabeth. I just want to stress it out again. For my community, please do not think that there is a link between autisms and the MMR vaccines. It's important that we have scientific study to support those kind of claims. So you have to make sure that you take your children to update their vaccination, especially for MMR, because these viruses is no joke. These viruses is really, really contagious and then can really affect your children. Please update those information. We are not here to politicize anything, but we are here just to tell you something that will help you to protect your children. Like Elizabeth said, there are so much study have already shown that there is no link between autisms and MMR vaccines. So I should stop here. and let the audience ask questions.
Okay, right now
I can
it's 40 minutes after 1. And before we continue on, we always have a little breeze from the South Seas, from the Pacific Islands, just only like maybe 10 seconds, and then we'll continue on. Just a little song here just to kind of, yeah, time to move. Shake it off, shake the measles off. Awa, go Mary, from the islands of Fiji.
Sylvia?
You have to share your sound with yours.
Right.
I think you're the only one that can hear it.
This song here is from the islands of Fiji. It's the same.
Yay.
Happy, happy.
You have to share your You have to share your sound with your
The people can listen to that, but for us, we cannot.
Okay, now we're gonna switch over to, before we continue on with Lupe and where's the other one? Murray. Where's Murray? Okay, I'm gonna give the opportunity again to Mary to Ifua. She's a registered nurse. I saw her raise her hands. Go ahead, Mary.
Oh, I can attest that the measles, the MMR is safe because all 3 of my kids, they're very smart. They have no autism. One's already done with college, 27. He's doing great. My
Thank
other
you,
one's going to
Mary.
be going to nurse. Their IQ is good. Get your MMR. I'm safe. I got my MMR at a really young age. So I have a challenge of educating because I go into the home and I do fit testing for the N95. I help teach them how to fit test for their staff, and that's kind of been a difficult thing, just learning how to do all that, and also the procedures of contacting the local health jurisdiction in case they have a COVID outbreak in their home. I think the regulation now is if you have 2 COVID outbreaks, you notify your local health jurisdiction. I'm also trying to teach them how to isolate their residents and also still do surveillance in their homes. So it's a big challenge. We have more than 5,000 adult family homes in Washington State. I'm trying to touch as many homes as I can. So I totally get it. The King County, you guys have your hands full with us adult family home providers.
Thank you so much, Mary.
Thanks for all the work that you do in the community, Mary.
Yes.
Thank you.
And she's the vice president for the Filipino community. Thank you.
Actually,
Okay.
I'm president now. I'm president of Latino Committee of Renton. So
Of Renton, yeah.
I'm trying to do a lot of networking and marketing in the Renton area, but I service homes throughout Washington State, extending from Blaine to Vancouver to Bremerton and Spokane.
Okay.
Just to add
And
on,
Marie, one of
just
my
to add
colleagues.
on, Sylvia, the MMR is actually 3 different viruses that are protected with that one vaccine. I mean, they are 3 different, but it's a combo. It's mumps and measles and rubella. Is that
Rubella, yeah.
Elizabeth? Yeah. Yeah. So
Okay,
just
thank
remember
you.
that when we're talking about MMR, it's not just measles. It's for mumps and rubella as well.
Okay.
Yeah.
Thank you. Thank you, Dr. Bakeri, for clarifying that. Now I know. Thank you so much for your patience, Maria. Now it's your turn. You can introduce yourself and your native country, and before we continue on, Maria.
Oh, are you talking about me, ma'am?
Yes.
Oh, yes. I'm Marie Mendoza, and I'm from the Philippines as well, like Mary.
Oh.
And I'm running an adult family home here in Bothell. I just took over last May. Before that, my mom's retiring now. So yeah, I'd like to know more about the adult family homes and the minimum requirements and just anything about the health care facility industry. Did you have a specific question for me?
No, I just wanted you to share, if you have any question about the COVID and measles, you can go ahead and ask the expertise that representing, like from the Seattle and King County Public Health, which is Elizabeth Beaber.
Yeah, I actually got in the meeting like halfway through because I, I did not get the notice right away. So I'm so sorry. I'm just now catching up. But yeah, thank you. Please go ahead. Thank you so much.
Can I add? Can I add to that? Maria is one of my clients. Her house. I've been to her house, and we're currently educating her and her staff. But just to give her some feedback and a step up on what she had missed. Right now, the public health, King County Public Health, is providing free vaccinations to your residents, but the funding, federal funding, is ending as of June 27th. So you still have that time to try to, because they need to do an intake form to get consent from all of your residents. So you need to get a hold of their power of
Right.
attorney and have them fill out the form to get consent for the vaccination.
Mhm.
Once you get that, you can fax it to them and they can come out and make an appointment with you to get your vaccinations. If after 26th, that funding does run out, you're gonna have to reach out to your long-term pharmacy
Right.
to get those vaccinations from them as well. But I think they're gonna have to utilize their insurance.
Right, right. Okay. Thank you, Mary, for that.
Yeah, and if you do have questions about, best practices for infection control or things like that, we have a whole team at Public Health King County that can come on site or answer your questions. So just send us an email or call Public Health and we can connect you to resources.
Thank you. Yeah, I do have actually someone coming over on the 30th
Oh, good.
for to inspect my home, mock inspection. Thank you.
Thanks.
Yes, ma'am.
Very nice. Okay, thank you, Maria, for joining us. Now we have more from the Filipino communities.
Thank you,
They're
ma'am.
both
Sylvia.
registered nurse. So I have Lupe Talamonis is King County Public Health Navigator. Lupe, I know that you are joining us a little bit late. You come always on the island's time, but you can go ahead and ask a question. Remember, the topic is about the COVID and the measles vaccine.
Thank you, Fatima. Well, I apologize for coming on late. I was on the other meeting, so but I'm driving as well, doing the same thing as well. That's why my camera's off. But thank you, ladies, for sharing out for the vaccination. COVID, I second motion what Dr. Pakila was saying. The vaccination, as I put it on the chat, it's a very helpful tool that really help us sustain the living lifestyles of the Polynesian islanders, Pacific Islanders. For growing up, I was witnessing all that vaccination, and it really helped me all the way till now, and my children and my grandkids, and also my family members. But what I wanted to ask is, if we have this COVID vaccination, gonna be part of the highlights for our members, community members, to be just help sustain up their healthy issues. What time and what time frame that they're supposed to be have it the next after the variant or after the variant? What time frame that they should be looking out for to it?
Yeah, thanks for asking that question, Lupe. So the latest COVID vaccine we have was made in September 2024. That's still the most recent one. And that vaccine does protect against the variants we're seeing now. So for the people who should be getting up to date with that vaccine, it's for most folks, if you haven't had a COVID shot since September 2024, then it's time right now to get that updated vaccine and you can protect yourself before the summer. If you are age 65 or older, or you're immunocompromised, moderately or severely immunocompromised, then you should have 2 doses of that shot since September. So if you got one in the fall and you fit those groups, then you should be getting another one.
Thank you so much, Ms. Elizabeth, because I really need that cheat sheet too, even though we share it on the King County navigators information and stuff like that. But since I have an event that coming up on Thursday for Juneteenth,
Right.
yay,
Yeah.
caravan. And I'm so looking forward to attend, and everybody's welcome to let them know that yes, vaccinations are really helpful for every family member, all the communities. So I really appreciate for the hard work that you all do. Thank you, Ms. Fatima, for broadcasting, and everybody work of advice. Thank you so much. I really appreciate you all. Thank you.
Thank you, Lupe. As you can see that Lupe is having living the living healthy lifestyle. It's coming up. Start at 9 a.m. till 1 p.m. And they also have the vaccination booth and TB testing booth. And also they have other activities, food and giveaways, families, friends, and games and fun photo booth. So please don't miss that. If you have the time, you can join in right at the Celebration Park behind the Safeway in Federal Way on 320th. Okay, now we only got about 9 more minutes. We don't have much time, but I'd like to, to say thank you so much, everybody. Please share this. If you have your Facebook page, you can go ahead and share that, or you can let others, know that it's also on YouTube Live. People can watch it on YouTube or Facebook or other social media like Instagram. I'm glad that you all asked a question. Feel free to raise your hand because we're very limited with the time now. But
maybe we should continue with the questions and just also make a comment that is really important for the community. To please remember, and Elizabeth, we also stress on this one here, that there are two differences between MMR vaccines and the COVID-19. COVID-19 actually require you to take the boost, and if there's more changes that happen on the viruses, there will be a need for a new vaccine. But for MMR, you can actually protect it long with taking the MMR vaccine. Can you, Elizabeth, talk about the differences in terms of protection? As we know that MMR vaccines, when we take it, it's going to be protect you more like lifelong protections. But for COVID-19, if any COVID viruses come again, we probably going to need vaccines. So that's really because of the format is too scientific on that case. But Elizabeth will talk about the that part.
We also have like 7 more minutes to go. Elizabeth, also I have someone, at the same time was asking me to please send it out, what is the sign of the measles?
Yeah, I can start with that. So what are the symptoms of measles?
Yes, symptoms of measles.
Yeah, so measles, it starts with a fever, cough, runny nose, sometimes a rash. As I shared before, it's extremely contagious and spreads through the air. And it can be a very serious disease where about 25% of people who get measles will end up in the hospital.
Oh,
and
wow.
especially young kids and those who are immunocompromised are at risk for pneumonia and brain swelling and even death. But as we talked about, the great news is that we have this very effective vaccine, and that the measles vaccine, the MMR vaccine, you get 2 doses, and that gives you about 97% protection, and that usually lasts an entire lifetime. So, and that is, it's different than we've been talking about COVID vaccine, and the COVID virus, it's changing, it mutates. And so we do have these seasonal boosters to stay protected against COVID-19. And so that's kind of like, for flu too. Flu is a virus that's changing. And so we have to keep giving these kind of updates to our body, like we would if we were updating, your iPhone, for your body to remember what that looks like and recognize it and have your immune system take care of you. So, but overall, the message here is that, we have these diseases that we can prevent with vaccines that can keep you healthy. And so summer is really a terrific time to get up to date with all the vaccines. And you can do that by talking to your doctor, hearing more about, what you may need to stay up to date, and then really be prepared to have fun this summer, to go on trips and not have to worry about getting sick from a disease that could have been prevented by a vaccine.
Yes.
Yeah, I just want to add on also, Sylvia, to Elizabeth's questions. Elizabeth, using the word immunocompromised, I know that a lot of Pacific Islanders don't really know that very big terms. But what it means is that your system is actually weaker. Yeah, so that's the time when your system, your defense system is weak, and that's we use the word immunocompromised. Yeah, because your immune system is actually affecting. It can be affecting from your chronic diseases, like for example, if you are having diabetic, high blood pressure, or those kind of chronic diseases, it will affect your immune system. Yeah, it will make it weak, and therefore you are vulnerable to infection, in any kind of infection. So that's one thing that is really important that you community should remember, that when you are sick of chronic diseases, make sure you take care of those ones, because you'll be vulnerable to infection with all these measles, COVID-19, flu, any kind of viruses or any infection that is happening. Your system is weak. So you have to make sure you take your medication, listen to your doctor, and keep the doctor informed about your status of your chronic disease. Thank you.
Okay, thank you. Like I said, that we're approaching toward the end right now. We only got 3 more minutes. And I have someone that was writing, just feel free, if you can put it on the chat box so that everybody could see that. But when you text, I don't always read it. Okay, the person that just texting, asking about the COVID vaccine, is the COVID is still around? Because it was like from 2020 to 2023, and then everything was released. How do I know that we still have the COVID, around in the environment?
Yeah, so it's been a long time, right, since COVID was first spreading throughout the world, and we do know that this virus is here, and it's likely here to stay, and it's able to change a little bit and continue to be in our communities. We know that each month we still see people in King County who are in the hospital because of COVID-19. And so we know that it's here. And what we want to try to do is, use our best tool, which is the vaccine that we have to, protect ourselves and protect our community members.
Yeah, just to add on the question is that the COVID-19 started dying out because of the vaccination. And then, like Elizabeth said, that there is a chances that the virus is still floating. Remember that we people are the ones carry the viruses around. And some people don't show symptoms, but they still carry the viruses. And so therefore, there's a chances that the viruses can mutate in you. And once it mutates, it can be stronger, it can be weaker. But if it is stronger, then you can transmit it. The viruses. It doesn't have to be showing symptoms to transmit the virus. These viruses actually can be transmissible without showing symptoms. So, but we thank for the vaccines, for the vaccination effort. That's why the virus is dying out. Yeah. So to answer the question specifically, how do we know that the virus is still going? Is testing. The only way we know if you go test, and then to prove that whether you still have the virus or not. Thank you.
Okay. Mary Nichol, I see that you have your hands up. Mary, I'll give you the last question of the day.
Well, I just have a quick question. Federal funding goes to public health in King County, and I just need to get access to Snohomish County. This is something the Pacific Islanders in Snohomish County are not aware of, that we have funding. So maybe I should just contact Snohomish County Public Health for but the time
Yes.
is catching up. June 27, correct?
That program is just for King County residents, that
Yes.
mobile COVID vaccine program, but absolutely check in with folks at Snohomish Public Health to see what kind of
Exactly.
resources they may have.
Yes, indeed.
Okay. Thank you.
Thank you.
Okay, thank you, everyone. Thank you. Big shout out, to you, Elizabeth Beaber. She's the manager in a vaccine program for the King County Public Health. Thank you so much. Thank you, Kate Cole, for always coordinate. She's the King County communication specialist, connecting with us on the health part and giving us the opportunity to learn more and get some knowledge and wisdom to, learn about health and be wise, how we live our lifestyle. Also, thank you, everyone. Dr. Pakieli, thank you so much for also clarifying, answer some of the questions. And Lai, Mary Tuifua, thank you. I'm so glad. Thank you for all the great work that you're leading in the community. She's a registered nurse and doing all this great work, to help others in the community. Lupe Talamoni will be there on Thursday and will bring the people, to show support. And I'm glad that you have the vaccines. We'll have our next event is not till July because there's a lot of things going on, graduation and other several stuff, so that would be the great time, to put up the community things. And Maria Catalina, thank you also. That's another Filipino. Thank you for joining us today. Mary Naiko from the islands of Fiji. Thank you so much.
Thank you.
Yes. Thank you so much, and also we're so grateful from Voice of South Pacific, which is our Pacific Islanders channel here for the Pacific Islander and connecting all of us. Thank you also, Lai, from the islands of Samoa and representing the Pacific Islanders Health Board too. I'm sure you get a lot of the information, Lai. Yes, it's thumbs up. So, and until then, we're looking forward to have another upcoming program, because it's always nice talk and discuss. Other than that, there's thousands of people will hop in, and view and read and share, the information, because it's on both channels. Thank you again.
Thank you. Thank you, Miss Sylvia.
Thank you, Pinaka.
Yes.
Thanks for that
Malo.
great question.
We'll have the little farewell song here. Dance as you move away. Racing from the islands in the South Seas.